Welcome to our clinic. Today, Dr. Kizrin will be attending these patients. Shall we go through the case file together? Let's go! Case 5-1. Patient had a minor class 1 cavity. The caries is suspected to be very shallow as observed from his radiograph taken. Another restoration he will be doing today is to repair his fractured 1-1. Case 5-2. This patient had a caries at the mesial surface of his molar. Case 5-3. Caries was found on the anterior tooth proximal region. She wanted Dr. Kizrin to help her as this particular tooth lowers her self-esteem. Case 5-4. Our last case for today would be this abrasion teeth. Now that we have sorted out our agenda, let's meet Dr. Kizrin.
Hello, I'm your dentist in charge today. You can call me Dr. Kizrin. Today, I'll be using composite resin on these cases. There are a lot of advantages in using composite resin as a restorative material. Let's briefly go through some of the advantages. Number 1. Classic. Yet the most important, composite resin is a tooth-colored material which will definitely cater to the need of highly aesthetic restoration. Number 2. It is a non-toxic material compared to his friend, amalgam, that can induce hypersensitivity reactions in certain individuals. Number 3. Composite performs an excellent micromechanical bonding to tooth structure, which also leads to advantage. Number 4. It does not need any retention foam, thus reducing the amount of healthy tooth structure loss. Lastly, composite has low thermal conductivity, which means it is capable of insulating the pulp from temperature changes and further pulp damage. Now, can we conclude that composite is the winner of tooth preparation? Yes, we can!
While waiting for Dr. Kizrin to do the restorations, I will explain some of the interesting facts about composite resin. Did you know composites are materials formed from a mixture of two or more materials? Components of composites are resin matrix, filler, initiator, inhibitor, stabilizer, tins, and silent coupling agent. The resin matrix functions to bind filler particles together. It will later polymerize and cause hardening of the material. Filler particles consist of crystalline quartz and silica glass. It is the component that provides strength, hardness, wear resistance, aesthetic and radial opacity characteristics of composite resin. The most importantly, it reduces shrinkage during polymerization. Silent coupling agent acts as chemical bond between filler particles and resin matrix. The bond prevents crack propagation and stress transfer. Butylated hydroxy toluene functions as the inhibitors to prevent spontaneous polymer formation. Next, tins provide shading and opacity. It is interesting that composite resin has come a long way since 1950s, and it can be classified based on its filler size, handling properties, and setting mechanism. Now, let's visit Dr. Kizrin again and see what he's up to. Let's go!
Hello again, viewers. I'm sure Nurse Aisha already mentioned about the polymerization shrinkage. Now, I'm doing the composite placement using the incremental placement technique to avoid the polymerization shrinkage that had account for many restoration failure. The polymerization shrinkage leads to marginal leakage, which subsequently causes marginal staining, post-operative sensitivity, and bacterial penetration that later leads to secondary caries. As a recap, composite resin can be used to treat Class 1, Class 2, Class 3, Class 4, and Class 5. I'm glad that my patients are very happy with my work. Let's take a look. I hope you have learned a lot from today's visit and find it interesting. Thank you for coming.